Hello guys, welcome to LabMed. This is my channel. I'm called Origa. So today I'm going to show you how to draw blood from the patient. I'm going to show you how to draw the blood from the vein of a patient. So this has been always a challenge to young medics who find it very difficult to convince a patient on how to draw blood. So the first procedure we're going to do here is to ensure that the patient sit in a good position. Ensure that your patient is in a good and comfortable position. This one is to create a good environment for him or her. The other thing you're going to ensure is you ensure that the request form that has been presented by the patient always give the correct information about him or her. This one is also to avoid errors during the collection of blood and the procedures that are going to follow. So another thing is you introduce yourself to the patient. Always start by introducing yourself to the patient. Tell him who you are, and he or she on his or her side should also speak. That is another procedure to do. Another thing to do is ensure that your materials you want to perform the collection of blood with is always assembled on your side. Ensure that they are always collected there. So for instance, here I have my materials I'm going to show you. So for example, here I have my sterile swab I'm going to use on the patient when I want to collect the blood. I'm going to show you its function later during that procedure. And also here I have my syringe. Here I have my 2 millimeter syringe. I have my 2 millimeter syringe. I will collect the blood from it. And also here I have my needle here. I'm going to use for drawing the blood. The bigger thing here, we can't draw blood and put it anywhere. So I have my vacutainers. So in this case, I have two top vacutainers. So this one is the purple top vacutainer, and this one is the red top vacutainer. So the red top vacutainer does not contain any coagulating factor, and this one, it contains a coagulating factor that is EDTA. It contains a coagulating factor which is EDTA. So this one is for collecting anticoagulated blood, and this one is for collecting coagulated blood. Yeah. So I also have my gloves here. I also have my gloves here. In this case, the glove will act as a tourniqueter. It will act as a tourniqueter in this case. So first thing you're going to do, the first thing you're going to do as the medic is to ensure that you locate the correct vein. Ensure always that you locate the correct vein. So in this case, I always advise young medics to always choose the mid-cubital vein. The mid-cubital vein is very easy to locate, and it is less painful when inserting your needle during the collection of blood. Avoid the veins from these sides. Always avoid these veins, because these ones are more sensitive, and always the patients always do complain because they are really painful. They inflict a lot of pain during the collection of blood. So what are you going to do? First, you're going to ensure that the position where you want to collect the blood from is always clean. And in this case, we're going to use our alcohol steroid swab. So this is how it is going to happen. In this case, I don't have a patient, so I'm going to perform. I'm going to show you using me as an example. So for example, I've located this as my vein. You see? I hope you're seeing that. So you're going to wipe it spirally from inside going outside. So in this case, you do this way, do this way, do that way. So that is cleaned. Ensure that this the place is cleaned. Yeah. This one you're going to check by seeing, you see the dot. I'm having that dot on the sterile swab. So until you achieve a clean surface, so you won't stop until you achieve the clean surface. After that, you're going to tie your tourniqueter. You're going to tie your tourniqueter. After, and you want to tie your tourniqueter you place your hand 2 centimeters below where you want to puncture the vein. Yeah, and so after doing that, you fix your needles. You fix your needle onto the syringe, and always ensure that the bevel faces up. Always ensure that the bevel faces up. Another thing also, ensure that the piston is always working. Ensure that the piston is always working by pushing it up and down, up and down. This one is to remove the air that is always accumulating into the barrel. Yeah, and so it will make it very difficult during the collection of blood, because here we'll have air bubbles. After doing that, after locating the correct vein and the vein puncture, the tourniquet should always not stay there for more than 1 minute before you are ready for the actual procedure. So after doing that, you anchor the vein with the less dominant arm. So in this case, the less dominant arm will anchor the vein I want to puncture. So you anchor it, and you take the fixed needle onto the syringe, and you insert at an angle of 20 degrees to 30 degrees. And the first flashback of the blood will tell you that you are in the correct vein, and you are indeed in the vein. Yeah, if you don't see a flashback, that is either you have missed the vein, or either you never tied your tourniquet in a good position, in a good manner. And also maybe you have injected the ligament, who knows? Yeah, so that is the correct thing to do during the blood collection. And after you have seen the flashback from the neck of this needle, you quickly remove the tourniquet. This one also has been a misled to most young medics. Yeah, you find that young medics always draw blood without removing the tourniquet. So what I'm going to correct here is, instantly after you have seen a flashback here, you start drawing blood, remove the tourniquet, and continue with the procedure. So after doing that, you take a cotton which has been sterile with alcohol, 3% or 5% alcohol, or the spirit if you have, and then you give the patient. You firmly give the patient here to take. Yeah. After doing that, now we want to transfer our blood. We want to transfer our blood from the syringe into the tube. For in this case, when you transfer it to the purple top, you're going to inject that rubber. After injecting it, you don't push, because there is a vacuum inside, so it just be sucked automatically. So you just push it, and you wait until blood collects. Stop pushing it. The reason we don't push it, we don't want our blood to hemolyze. We don't want to destroy every consequence of blood. This one is to achieve accuracy. And another thing we're going to do, for instance here, you also do the same. You take the blood and you collect it by injecting into the rubber on the Vacutainer. After doing that, you have to always insert. You always have to turn. You turn the Vacutainer. So in this case, if it is a red purple tube, you turn it 5 times. You mix the blood well. Yeah, you mix the blood well 5 times. In this case, when it is on the purple tube, you mix the blood 8 times, inverting it to 180 degrees. Your hand should be 180 degrees as you invert it. So after doing that, you place the collected blood onto your racks, and then you can release now the patient. And always ensure that after blood collection, you label each and every the details of the blood of the patient, I mean. Yeah, so after doing that, you clean your bench, and then you wait for the next patient to come. So I really wanted to share with you this one, because it has been a really mistake that young medics do. So until next time, pleasure having you. Please subscribe to my channel. Thank you.